The major task that has faced various past administrations in Abia, God's own state, is how to bring qualitative and affordable healthcare at all levels to the doorsteps of the people of Abia. While past administrations have made their own contributions, one area that remained intractable was the non-availability of a world-class specialist diagnostic healthcare institution in this part of the country. The implication was that doctors, particularly at the tertiary level of healthcare delivery, were handicapped in promptly responding to patients with complicated health challenge that required first-class medical attention. It is common knowledge that without sound diagnosis, medical practice is as good as guesswork or quackery. Again, lack of specialist diagnostic facilities in Abia State, which has a federal medical center, teaching hospital, many private and government hospitals, and schools of nursing, etc., negatively affected not just medical practice but teaching, learning, and research in the health sector. Professor A.U. Mbanaso captured that past ugly trend.
Before the establishment of the Abia Specialist Hospital and Diagnostic Center, we had several problems in the state in diagnosis. You know, for you to effectively treat your patient, adequately you must establish a diagnosis. And following that, you treat your patient. But here, we didn't have many of the gadgets with which to make the diagnosis. Take, for example, somebody had abdominal pain with associated swelling, and you don't know what has swollen among all the organs in the abdomen. In those days, what a surgeon would do would be to open up and see. Medical science has gone beyond that. That you should be able to know what that mass is, or the tumor, the nature of it, the surrounding organs, to determine how to manage the patient. With the establishment of the diagnostic center, it's now possible through maybe the ultrasound machine that was installed or the CT scan to know what that problem is, and you now prepare yourself before trying to operate on the patient if that mass is operable. Now we have our own diagnostic center where in one complex all these equipment are installed. It's now easy. The issue of leaving Omaha to go and look for a place to arrive at the diagnosis, the question is over.
When in 2007, a man of the people, technocrat, astute administrator, and a pivotal contributor to re-engineering rural healthcare services, Chief Theodore Ahamefule Orji, was sworn in as the executive governor of Abia State. He met this situation and resolved to tackle the problem. What informed Governor T.A. Orji's decision in this direction?
Well, what prompted me to do what I did in that aspect is because I know that health is wealth, and that if you are going to provide dividends of democracy to Abians, they must be healthy to enjoy the dividends. Like I always say, it's only a healthy man that knows that there is light, and when there's no light, the healthy man can agitate, please give me light. It's only a healthy man that knows that the taps are not running, and when the taps are not running, he can agitate and say, I need water. Therefore, I consider it very, very essential that my people have to be healthy in order to enjoy all these good qualities in life. And then when we traveled abroad for Medicare, I went to one specialist hospital in the US, and what I saw there excited me. And this thought came into me that if I can replicate what I've seen there in Abia, that will satisfy my conscience, and then I know that Abians will be happy for it. So when we came back, we started on that project, and when we went to Lagos, with Professor Mbanaso, my personal physician, we saw something similar to that. And he came and told me. And I immediately told him to go and invite those Indians, Mikio, for discussion. And they came. Discussion started, and we took off. And I saw in them people you can rely on, because when we finished discussing with them and entered into an MOU with them, they kept faith and never relented. Even at the height of kidnapping, they were working until that diagnostic center in Umuahia was established. And then we extended it to Abia also, so that it can have a wider coverage. Therefore, it is my vision and my aim of transforming the healthcare in Abia State. And I'm happy for it. That does not end there, you see. It's not only the diagnostic center and the specialist hospital. We're also doing very well in the provision of health centers. Today we have a total of 210 health centers in Abia State, well equipped. We have personnel, and we're looking for more personnel to manage these health centers. So if you combine that, the health centers and the specialist hospital and diagnostic center, I'm not talking of the general hospitals that we are innovating and putting life into. So when you combine all of them, you see that Abia has done very marvelously well in healthcare. We have received awards, this state, myself, and a lot of people have been giving me awards. Some I take, some I reject. So that is a pure indication that Abia has excelled as far as healthcare is concerned. I want to take healthcare to the highest level, 100%. That's what I want to deliver. If it's possible for me to deliver healthcare 100% to Abians, I'll do that. We have started very well, and I'll continue pursuing that. If there's any way I can improve on that diagnostic center, but I know right now the standard is very high. The highest quality of equipment is there. If you go there, you will see. And people from far and wide come to commend us. Those who have traveled out and seen equipment, they come in, they marvel. Because not many people know what is there. They marvel when they see that. So it is our intention to take healthcare to the highest level. We'll still continue pursuing the establishment of health centers, because these are essential. We still continue pursuing the issue of training and retraining our personnel and recruiting more, so that healthcare will reach every person. We still continue pursuing the issue of renovating the general hospitals. So those ones are still ongoing. So the aim is to take healthcare to the highest level. And expansion, of course, we have started. If you go now, you see the difference. Abia State government has been able to acquire the adjoining land to that place, which we bought at, I think we bought it at 45 million. And the structures there will go down. We have to expand so that that place will have a parking space, additional offices, and additional wards for patients. So we'll continue expanding. If we see any land that is vacant around that place, we negotiate with the owners and buy the place. If the owners are ready to sell, we'll buy for Mikio, for the specialist hospital, not for private use. The same thing in Abia also. You know, we have one in Abia that is just very close to teaching hospital, Abia State University Teaching Hospital Abia. That one has no problem at all, because there is land and there are features for expansion. So when the need for expansion comes, we will do that.
It is one thing for government to announce a policy of providing the health sector in Abia State with centers of excellence for specialist diagnostic services, and another thing to actualize it. Abians can count on Governor T.A. Orji, for his word is his bond, and true to type, on the 18th of March 2009, government promptly swung into action by acquiring the former Aloma Specialist Hospital at Abia Road, Umuahia, from Dr. Anayezibe for the Umuahia Specialist Diagnostic Center.
No matter how highly specialized, who hasn't got a good, nearby, efficient laboratory to help make his diagnosis is just wasting time, because treatment and diagnosis are very effective aspects of medical treatment. You have to know what you are treating. For this, both the diagnostic center or people working in it and the specialist doctor have to update their equipment, their knowledge from time to time. So, establishing a diagnostic center here is of great help, because that knowledge that we go to seek abroad has been brought home, and having come home and connected to outside purifying institutions, just like this one is connected. I did an X-ray 2 days after. The report came from highly qualified radiologists. With this report, I just saw it myself, and I felt I wasn't going to die.
Why was the then Aloma Hospital, Abba Road, Umuahia, and Abia State Teaching Hospital, Abba, chosen as sites for the establishment of specialist diagnostic centers? What other steps did the government take towards realizing these projects?
You see, that place is very central, extremely central, can be accessed by any other person from the state. And we were fortunate. At the time we were about establishing this MICURE, Dr. Anage Zigbe, a well-known physician, was willing to give us the place at a very minimal cost. We negotiated with him, and he said, if this is a sacrifice that I'll do for my state, that he will happily do that. So he relinquished the place to us. And then we had to renovate it and bring in the equipment. And MICURE is there working for the good of Abians. That is why it is there. That place is central. And then the circumstances under which we acquired it.
Number one, none of my children is a doctor. Number two, I've practiced for 48 years. And number three, when we go to doctors' functions, you'll be standing there, one or two doctors will come and tell you, sir, I was born in your hospital. At that stage, I think I've done enough. I should give way to younger doctors. I should not be seen queuing for retainership with them. Because if you do that, you lose all the respect they have for you. I'm a life licentiate. I won't pay a kobo for medical practice for the rest of my life. So these were the considerations. First of all, I wrote in paper to former governor before TA, making these suggestions to take the hospital and turn it into a specialist hospital in collaboration with outside medical setups. He did nothing about it. I've been going out on health reasons. So at one time I came in here. I didn't know how Ochendo knew that I had come back into the country. He sent people, I should tell him, give him an appointment, and I gave him 1 o'clock on a Wednesday. Exactly 1 o'clock on that Wednesday, Ochendo was here. I understand you were away, and I heard you come back. I just want to come and so we chatted. is there anything I can do for you? I said, well, nothing really, except that I had made such an offer to previous government. And they did nothing. Then he asked me, is the offer still open? I said, yes. Then he took it on. And he did everything possible to make it come into reality.
The 200-bedded specialist hospital and diagnostic centers on 1st November 2010 opened their doors to patients requiring first-class specialist diagnostic health services. However, the two centers in Abia and Umuahia were simultaneously formally commissioned by the President of the Federal Republic of Nigeria, Dr. Goodluck Ebele Azikiwe Jonathan, on the 26th of February 2011.
We thank you for this initiative as I commission this diagnostic center for use of our medical students to solve our health problems in this country to the glory of God. Thank you, sir.
What facilities are available at the specialist diagnostic centers situated at Abia, the Abia State Commercial Nerve Center, and Umuahia, the Abia State Capital? The medical director of the Specialist Diagnostic Center, Abia Road, Umuahia, Professor A.U. Mbanaso, unveils the state-of-the-art facilities, personnel, and services for diagnosis of patients' problems.
In Umuahia Center, as well as in Abia. That center is at the teaching hospital complex. The equipment installed are the same, duplication, except for one. MRI is in Umuahia, there is none in Abia. But every other thing is replicated in Umuahia as well as in Abia. Let me tell you more about the equipment. Let's take the simple one of a digital X-ray. The digital X-ray is very important and handy. Simple thing to know is that use of digital X-ray don't have any more dark rooms where you have to wait and go and develop your film. But in this one, within it, if you take an X-ray, within 5 minutes the film is out. But more importantly, anyone whose X-ray is done here, that X-ray can be transmitted to overseas for another person to look at. Maybe I'll give you this exciting news. After the election, one young man who came from US had a road traffic accident, a ghastly one, where his neck bone was involved, broken. But through the digital X-ray and the CT scan, it was found out what had happened. And that X-ray, the film was transmitted to US where he lives, and the hospitals were there, seeing what had happened, gave instructions, so that when the man had to go back, they were already waiting for him, organizing a theater to steady the bones that were broken so that he didn't get paralyzed from neck down. They raised their hands for Abians and Abia government and our governor that day. So the issue about the digital X-ray is very good. Within a few minutes come out, the results will come out. Then we also have installed a mammogram. Mammogram is to help to dictate any mass or tumor or swelling in the breast before ever the hand can palpate it and feel it. When it was established many years ago in Scotland, Professor Forrest used it in screening women for breast cancer. You know how deadly that disease could be. But the hope for cure is early detection. And we now have it in our center. We use it for screening, we use it for diagnosis, we use it for making sure people are treated early. Also installed here is a CT scan. The CT scan was the in thing after ultrasound. With that you can watch any part of the body, see it, whether the thing is in the brain or in the bones, in the spine, everywhere. In our student days, if somebody was suspected of having a tumor in the brain, maybe of the pituitary, it used to be saying you take a plain X-ray, check whether the cellular toxica is widened or not. But now you do the CT scan, if there's a tumor there, you will see it. And you don't need to do what we call angiogram to locate a tumor. With the CT scan, we will do that. The same thing goes for the MRI we have established, which is also superior to the CT scan. These now are available. You have bone swelling, something swollen that is an area the hand cannot even touch or palpate. You can easily see that. But I want to tell you about the laboratory, the state-of-the-art laboratory we have here. If you take a sample of blood, it can churn out 2,300 results. And as you put it there, within minutes, the results will be there, depending on what you're asking for. Is it the lipid profile, or the thyroid function test, or body hormonal assays, whatever. They are there. These are the things for which people, especially the people who have problem with in medicine, what we call the internal medicine department, they make use of the laboratory very easily, analyze blood. You do it now here in Nigeria, in Abia State, in Umuahia, not to go overseas to check these things. I know years ago, if people had a prostate problem, they say, oh, give us a pinch of the blood, put it in an ice pack, transmit it to us abroad to do a PSA. PSA is what determines how the prostate, whether it's cancerous or not. But these things are done here very easily. Okay, we also have the ultrasound. I've said it's useful for people who have swelling in the tummy to determine what those swellings are and other things. There's also a big advancement here that we can discuss medical issues with our friends abroad, with our colleagues abroad, compare notes. People in India, people in the United States or Germany or Britain, by teleconferencing that is installed there. Part of fact, that was how the head of state flagged off the diagnostic center. It was so important that it had to be attracted to do that. Because one of the things that has happened is that this is the only one center in Nigeria where all these things are installed. There are dotted out places in Nigeria where you might have a CT scan only, you might have a MRI only, you might have just ultrasound, but here, every of those things are in place.
The Chief Medical Director, Abia State Teaching Hospital, Aba, Dr. Owa U. Iweha, speaks on the importance of the facility.
Some of them who are even saying they want to go and do these investigations overseas and that kind of thing, can now see that the results we have here are equivalent to what they'll get there. So they cannot, I mean, it spares them at least nothing else with flight ticket and everything. The cost of things come down. And then we have people now, some of them ask you if you have such facilities in the country. So instead of going there, they do the investigations here and email the results to them. And there's no need, they'll get advice from their doctor overseas. There's no need traveling all the time.
In order to ensure proper management of these specialist diagnostic centers, the Abia State government entered into public-private partnership with a tested and renowned Indian company, Mikio. In less than 1 year of the existence of these centers, what are their scorecards?
Interestingly, I have been there once. There was a time I wasn't feeling very well. I called my personal physician and told him to take me to a diagnostic center. And I went there. And they put me into their machines and certified me to be okay. And the interesting aspect is that I paid. Because that is one of the things that kills government establishment. You have to pay. There's no point of saying I'm a commissioner of this and this or this, give me preference. I paid on the spot. Therefore, that has saved me the problem of going outside Umuahia to take care of myself or going overseas. So I have started patronizing the place, and I've been directing my friends to go there also and take care of themselves. My advice to the staff and management is for them to be diligent and see that establishment as their own and treat it the way they will treat their business. That is my advice, for them to be diligent. Then to Abians, I've said it, they should make themselves available. Those who are sick, it's not for every person. Those who are sick should go there for assessment.
In establishing a hospital of that magnitude, I think it was the only one of its type. Yes. And to give it away normally should draw tears. But when I came to realize that this institution that was put up to help human beings health-wise is now doing that job at a superlative level, I am happy, I am contented. And Ochendo should be thanked for that.
Gone are the days when people from Abia states will travel abroad and to other states in quest or in search of these services. In Mekyo Diagnostic Center, you can get your MRI done. Reports will come out within 24 hours. CT scan, the same thing, sonography. All these machines are here. So what is the essence of traveling abroad anymore? They can get the same service in Abia State.
So far, so good. They have been, I've had series of tests here, and compared with what I had before this time elsewhere, I think there's a lot of improvement here. Improvement in that the staff, they're very friendly, there's not much delay. The charges also is not too high compared with what is obtained elsewhere. We have had tests, and the result is very prompt. They give you the result without much delay.
There is no doubt that the establishment of these centers of medical excellence for specialist diagnostic health services by the Executive Governor of Abia State, Chief T.A. Oji Ochendo, is the right step in the right direction. Indeed, Abians are now part of the global village where specialist diagnostic health services are at the beck and call of all patients. To God we say, be the glory.